So welcome. Thank you everyone for taking the time out of your day to be here today. We're very excited for what is our first presentation in a series of sessions that we are going to be conducting from our grant recipients of the 2021-2022 MHCH Foundation's Global Rural Nursing Virtual Collaboration Learning Grant. Each one of our presentations will allow our grantees to share scope of their project and the outcomes learned. Joining us today to share a little bit about the GRN VCLG and how you can apply for this year's grant opportunity is Corey Kilgore, the Executive Director of the MHCH Foundation. Hi, Corey.
Hello. Thank you, Stacy. And thank you everyone for joining us today. I guess I just want to say that on behalf of the MHCH Foundation, just want to let everyone know how honored we are that we have the opportunity to share these grant opportunities with your classrooms. And thank you. This is the first, actually for our foundation, this is the first. We're generally a foundation that operates based upon creating and delivering programs. This is the first go around as far as offering grant opportunities. And it has been a really exciting experience for our MHCH board to see all of the interesting things that each of the groups have been working on throughout the academic year. It's really been inspiring. I also really want to thank you guys for coming back for this presentation. I know that summer can be a very sacred time and for you to circle back after the semester's over and share your work with us is really appreciated. And as Stacy said, it will be recorded, and actually we'll have the opportunity to share what you've learned and share your work with others, hopefully around the globe for hopefully many years to come. So what that does is it allows us to really increase that footprint in terms of the learning opportunity in a way that goes beyond your classroom. So thank you very much for being the first round of grantees. I think we've already learned lots of information from each of you, not just about your work, but also about how to make these grants work more effectively in the future. That grant application process is already open for the upcoming academic year. Hope to see an application from all of you again. It's perfectly okay to apply a second time. So we're excited to see what we have next year. And I think that it will be awesome for our new applicants to have the opportunity to see what happened last year. So anyway, thank you very much. And I'm excited to hear what you have to share.
Thanks, Corey. Before we get started, just a brief housekeeping note that we have budgeted plenty of time for questions, but we are going to hold those questions to the end of the presentation just to allow our presenters the opportunity to get through their slides and to share all of the incredible details of their project. At the same time, you can feel free to use your Q&A panel or the chat panel if you have a question that you don't want to escape you before we get to the end. We will be going back in and fielding those questions on your behalf at that time. So without further ado, I'd like to introduce today's presenters. Today we have Jessica Smith. Jessica is an assistant professor at the University of Texas at Arlington College of Nursing and Health Innovation. She received her PhD in nursing from the University of Wisconsin-Milwaukee in 2016. In 2018, Jessica completed a 2-year postdoctoral fellowship at the Center for Health Outcomes and Policy Research at the University of Pennsylvania. Her areas of interest include understanding the needs of the acute rural nurse workforce to deliver safer patient care and how work environments and processes influence nurse well-being. Presenting alongside Jessica is Kim English. Kim is a registered nurse who has been teaching nurses at the undergraduate and postgraduate level since 2002. Prior to that, her background was in acute care and professional practice. Kim is currently a doctoral student, completing a Doctor of Education, Education Leadership, with a focus on educational technology at William Howard Taft University. She completed her Master of Nursing at the University of Toronto, Bachelor of Science in Nursing at X University, and her nursing diploma at George Brown College. In 2020, Kim was the recipient of the Trent University Award for Excellence in Online Teaching. Kim's research focus is working in rural and remote settings, looking at nursing practices in those settings. She also addresses issues in the provision of nursing education through the use of virtual stimulations, the impact of inclusive, anti-racist, and anti-oppressive approaches to education. Kim has a particular interest in addressing racism in healthcare to serve as an ally to Indigenous populations. Kim has worked as a locum RN in remote Northern Ontario and will be engaged in a project to support nurses working in Nunavut. And I do hope that I pronounced that correctly. So before we go any further, I would love to turn this over to Jessica, where we can start our wonderful presentation today. Jessica, I'm giving you the controls right now, so you should be set.
Okay, can everyone see?
Yes.
Okay. Hello, my name is Jessica Smith, and I'm pleased to present today about our project, an international nursing collaborative to assess and improve access to rural healthcare services. So first, I'd like to begin talking a little bit about what our project's goals were about, and a little brief introduction of the schools and individuals involved, which Stacey gave an introduction for myself and Ms. English. And also I wanted to acknowledge the hard work and participation of Dr. Linda Hutchings and Dr. Sue-Ann Nestor, who are also a part of making this project successful at the University of Texas at Arlington College of Nursing and Health Innovation. And also I want to acknowledge and thank the Global Rural Nursing Exchange Network and Matson Halverson Christensen Hamilton Foundation for funding this project. So a little bit about the goals. There were twofold. So the first was to learn about acute rural nursing and the care of rural populations across countries. So in the US and Texas and in Canada. So UTA is located in North Texas, and the area of Canada that we collaborated with was in Ontario. And also we wanted to establish connections across our universities and our countries and really talk about what some of the challenges for rural healthcare access are for nurses, and then what are some of the challenges populations face and what this means for how nursing could maybe address those challenges. And so I'd like to acknowledge all of these students that participated in our project from the United States. And we had 2 cohorts from both the US and Canada in the fall and spring. And so in the fall of 2021, we had Benjamin Guzman, Jessica Soto, Maria Gorowski, Nibia Faruqi, and Sophia Hong. And in spring 2022, we had Abigail Apia Mensa, Brenda Haidt, Dion Williams, Gina Bollinger, and Gina Kamari Patel. And then in Canada, we had students from the fall and spring. So we have Brianne Elbers, Brooke Elbers, and Brittany Sear. And then in spring, we had Ann Mead, Emma Lindale, Alexandria Jakowski, Caitlin Bell, Julia Harris, Connor Kustrich, and Alexia Davidson. And so a little bit about how we conducted our project. And so in both the fall and spring, we had monthly meetings where we met as cohorts from September, October, November, December, and then in the next year, February, March, April, and May. And we also met in the US cohort outside of the international meetings to discuss a little bit about what rural healthcare needs were for the US and Canada, what the differences are in our healthcare system and how it's structured and how that might play into healthcare access. And to enrich the meetings, I provided readings and came up with questions before the meetings and encourage our students to also think about what did they know before the project about rural nursing and healthcare access, and keep that in mind as they progress throughout the project. And then at the end, come back and revisit that. What does that mean for them? And we saw a pretty incredible growth in their thinking, which Kim will talk about in the upcoming slides. But I wanted to talk a little bit about one of the highlights of our experience, which was we went to Children's Regional Medical Center. The US cohort made an in-person visit both in the fall of 2021 and in the spring, where we actually went and for a night and for a couple of days, like where it was a one-day hospital visit, and then the night before we had dinner with the nursing administrator, and we received really good feedback about everything the students learned. They learned more about what happens in the rural hospital, how they provide care to their local rural communities, as well as some of the things they do to keep funding in the United States. And we also had a way to get our Canadian cohort to see it, which was through our robot, which is something Dr. Hutchings helped us a lot with, getting it set up and everyone logging in on it and kind of seeing virtually the site visit. So that was definitely one of the highlights of our trip. I want to share a few pictures. And on the left, we have Benjamin and Dr. Hutchings, and that was in the fall and in the spring. We have a picture in the middle. There's Gina Kamari and Sheena and Brenda, and then we have some of the local cattle at Childress here on the right. And as I said, there were several guest speakers talking about different aspects of rural healthcare that were a challenge with the access. Emergency medical services came and spoke. The students got to tour the hospital and speak to different nurses working on the units and talk about staffing and talk about financial challenges, as well as health policy and advocacy in the US. And here's another picture of us getting connected with our collaborators in Canada. So that's Dr. Hutchings and Professor English getting connected up to have our learning in those days. And now I'm going to turn it over to Professor English to talk more about how grant funds supported this project.
Thank you. Thank you, Dr. Smith, and thank you for the opportunity to talk about this particular project and the things we were able to do. So as you saw from the pictures, the US cohort, the grant funding was used to provide a scholarship to assist with the cost of traveling to a rural hospital site in Texas for the immersive site visit, which totaled $2,500 in grant funding to support the US cohort. We had a few more challenges on the Canadian site, which I'll talk about in terms of challenges in a moment, in terms of getting to an actual visit on our location. And so that's something we'd like to see happen in the future. So the funds for our group were used then to provide student participants with a stipend to support their participation, as they were doing this outside of class time and engaging in reflections outside of class time as well. So a recognition of the time and the effort that they were bringing to conversations that we were having as part of this project as well. So some of the outcomes that we saw then, in terms of comparisons, it was funny because I think we probably, at least perhaps I did, I'm not so sure if Dr. Smith would concur, entered into this thinking that we would come out with more differences than we did similarities. But I think in the end, we realized that there's far more similarities than there are differences in the rural nursing and healthcare access challenges between our two locations. So for us, the exchange really highlighted globally that there are more similarities, as I said, than differences, and particularly as it related to access issues. We noticed and had a lot of conversation about infrastructure challenges. So, for many of the patients that we're supporting and providing care to, it comes down to transportation. So it might be that there's no public transportation. I know, and again, perhaps some of our participants might jump in the question and answer and talk about this, or Dr. Smith, but I found that some of the questions we were getting on as the Canadian cohort really were a lot of interest and trying to understand what happens in some of our more remote settings. So Nunavut, as was mentioned in the introduction, is one in particular where if members of that territory need care, they often are flown out of community. And so, just the conversation about how much it would cost to fly somebody out of community, because it's upwards of it can be close to $20,000 for an evacuation. And that's not a cost that would be borne by that patient. It is a cost that's covered by our federal government. And so we had lots of conversation and sort of background information provided to talk about that and provide that comparison. And then similarly, we talked about what happens if you don't have a car, and how do you get to a location if it takes, a lot of the students who are making the trip out to the immersive experience talked about, what it was like for them in terms of planning and thinking about traveling that distance. So imagine then the flip side, if you've got somebody who needs care, who is having to do the same. And so a lot of really good conversation around transportation, infrastructure challenges in terms of the internet as well. And we saw this ourselves. So in the first immersive experience, we actually were able to, I felt a bit, as I joked, like Sheldon from the Big Bang Theory, being rolled around the hospital, but we were able to actually go and tour some of the locations of the hospital, but we kept losing connectivity when we would do that. And then it would take time to find a spot where we could get set back up again and make those connections. And so the second time we participated in the immersive experience, we didn't do the touring part of the hospital, but rather just sat in on the presentations taking place in one room where we knew that we would stay connected and we wouldn't have to worry about that. So even for us, we experienced those challenges around technology and what that meant in a site. So it really brought home the need for changes for us as nurses to be promoting around policy, and which we'll touch on here. Nursing staffing shortages, they were similar, but some differences with that too. So in terms of our ability to participate in an immersive experience in Canada and share with our US cohort, we had a partner hospital that we'd hoped to do that with. They were experiencing such critical nursing shortages that they asked us not to do that, because they were also in the midst of bringing in a new computer system. So, we had shortages impacting us that way. So we were able to talk and provide some comparisons in regards to those nursing shortages across countries. And again, talked about what that meant for some of our more remote locations in Canada, where you have nurses who might not be living in that community on a regular basis, but perhaps go in for a period of 4 to 6 weeks and provide care on a locum basis, and then leave that community and might come back again. So we had a lot of conversation about the the use of locums for that purpose and the impact on community when you do that. A lot of conversation, not surprisingly, about maldistribution of healthcare services across rural and urban areas. And so again, we had those similarities in those conversations, but things such as maternal child care, for instance. I know the cohort that I was working with in Canada were very pleased to see that there was still some access to perinatal services, because in many of our rural hospitals in Canada, that's something that's been lost for lots of reasons, but it just means increased travel times for patients who are needing to access those services. So we were able to have some good conversation about why that happened and what that meant for those communities when it came to those services. In terms of differences, we certainly did acknowledge that there was a significant difference around funding. And so our students still, the Canadian students still came back to that, and kind of struggled with that notion of how much it costs for healthcare. I think, again, we get a bit complacent in Canada sometimes and take for granted the benefit we have in terms of our universal healthcare and access to that. And you see that coming through in these conversations where we were sort of, you know, comparing and talking about what happens when it comes to funding. So we had a really great presentation from the financial services at Children's who talked about, you know, what happens if somebody comes in on an emergency basis and doesn't have coverage, for instance, and our students really got to benefit from that. And we had a lot of conversation afterwards around, you know, how does that compare to Canada? And we were able to say that, you know, in some cases there are things that Canadians are expected to pay for that we don't necessarily think about in planning care. So a lot of conversation about that, conversation about healthcare policy as well, and the differences in relation to that across countries, but also the need for nurses to, in rural and remote settings, to really be engaged in healthcare policy and look at ways that they can make change. So just even as an example, one of the students that I was working with talked about how you know, having these conversations made them think when they went back to their clinical setting about instructions that might be given out with the idea that everybody lives in an urban setting and not really reflective of somebody who might be coming from a rural setting. So for instance, if your discharge instructions said, you know, return to our emergency department, and they traveled 2 hours to get there, the likelihood of the person returning to that emergency department might be quite slim. So are there other options, and how can nurses influence those conversations and those things that happen within institutions? We did also talk about the distinctions in rural and remote nursing and healthcare. And so, and we're guilty of this in Canada sometimes, that we kind of lump rural and remote together, and really there is a distinctiveness for us. So when we talk about remote, we really are talking about settings where access is limited. And so the only way you can get into those communities is by boat, by plane, or by an ice road. And so that changes the nature of care in those communities, because it's harder to get out. And if the weather is poor, those nurses are caring for sometimes critical patients until they're actually able to access a way to get those patients out and seek additional care. So we really, you know, we had some good conversation and learning around those differences between rural and remote, and what that might mean for populations. Next slide, Jessica, thank you. So overall, what we saw from both cohorts really was increased growth in thinking about rural nursing and healthcare access in US and Canada from the beginning to the end of the learning experience. And I think both groups of students talked about, you know, sort of having that light shed for them on the fact that rurality really is global. And so, you know, there are communities that we might not think about, or areas we might not think about, that do have similar types of experience in rural communities. The students in the US cohort had an increased interest in rural nursing and healthcare after the experience, as well as an increased understanding of the challenges that rural residents face in accessing healthcare. Similarly, for the Canadian students, I think that most of the students who chose to apply to participate had an interest in participating, and this just solidified moving forward for them. And even thinking, you know, we joked in our final wrap-ups about whether students would be attracted to go across country and work, as we're seeing the influx of travel nursing. And you know, I think certainly from the Canadian cohort, there was that thought about, you know, I could perhaps go to work in Texas, for instance, as a travel nurse in a rural community, and hadn't thought about that before. And you know, it certainly opened notions of having these international conversations, so that we recognize where we are more similar than we are different when it comes to rurality and nursing practice. Next slide, please, Jessica. Thank you. So for both of our cohorts, we had a final wrap-up meeting with everybody just recently, a few weeks ago. And so it was lovely to see as many people attend as were able to, and talk just in generalities about the impact that participating in the program had on them, the learning that they took with them from the experience, the hope that they could engage in future experiences. I know that both student groups shared links to events to participate in activities that their student associations were having with one another. And so it was great to see those connections and those collaborations happen. So we really had a great conversation about how the program impacted thinking about rural nursing and healthcare access. And students also posted on the forum some of the learning and some of the benefits that they had from participating in the experience as well. Next slide, Jessica. Thank you. So we think that there's lots of future opportunities when it comes to these types of experiences, and having the virtual access, I think, also really increases those experiences. So it's, you know, a number of schools of nursing have trips perhaps where they might do a medical type mission to an international country and go into a rural setting. And sometimes for some students, I know we do this within our school and there's fundraising and support for that, but sometimes it is not attainable for students to be able to engage in those types of exchanges for lots of reasons. And so this virtual format really showed us how we can enable more of these conversations and more of these connections, and you know, allow people to pop into another area to see. So for instance, when in the introduction, when it was mentioned that I am starting a project in Nunavut, one piece of that project is recording the realities of nursing in that community to be able to share with other nurses so that they can see for themselves. This is what it's like. This is, you know, what you might have access to in that community. So there are tremendous benefits to these connections amongst nursing students globally, to learn about rural healthcare access challenges, to get them thinking about that regardless of setting that they practice in. I know a common conversation that we had in the Canadian cohort, and I believe it came up in our conversations as a group with our US counterparts too, was the fact that all nurses, regardless of whether they practice in a rural or urban setting, should have an understanding of the realities of rural nursing and rural health access and healthcare issues, because the larger centers will get those patients who need that more acute care. And so they really need to understand so they can ask those questions. And similarly, the collaborations also and connections benefit us as nurses and faculty members to be able to talk across countries and across communities to be able to share that learning and understanding. Next slide, Jessica. Thank you. So in conclusion, we found that cohorts in both countries learned about rural nursing healthcare challenges and the care of rural populations in the US and Canada. We found that students and faculty from both countries and institutions were able to collaborate virtually with a few little bumps here and there, but we figured things out and made it work. And the support of this grant really assisted in our being able to do that and broadened perspectives around rural nursing and healthcare globally. And so we all benefited in so many ways from having access to that. And then our next slide is our questions or comments slide.
Let me hop in. This would be, if anybody has any questions about the program or about anything specific that was discussed today, please do go ahead and send us that in the chat or in the Q&A feature on your Zoom, and we will relay that forward.
Do you want me to stop sharing so you can share your screen, or?
Yeah, sure. That would be great. Thank you. And we do have something coming in. It was asked, did the students receive more critical care training?
So I could speak for the Canadian group. Yes and no. Some of our students do if they take a particular course, and it is a requirement for practicing in some of the more remote settings that they have taken this particular course before they go there, because of the increased acuity and increased accountability for the nursing, for the nurses who are working there who might be precepting a student. So if they're going to a rural or remote community, yes, in Canada, they would need to have that.
Another question we have asks, did you experience any challenges with aligning your academic calendars to facilitate collaboration?
We did, but we overcame those challenges. We communicated a lot about figuring out when our students would be most available, and tried to have as many people as possible come to each meeting. If we couldn't have, if someone couldn't make it, we asked the group if it was okay if we recorded so that everyone could review it later. So we came up with strategies as we went with how to overcome some of those challenges.
Would you mind sharing with everybody what your favorite part of the collaboration was and why? It's a tough one.
Well, just, getting to interact with everyone, even on my campus and at Canada, and just having this opportunity to use the virtual platform to overcome distance and be able to connect with everyone, sometimes synchronously, sometimes asynchronously. But I think it was just being able to collaborate and exchange ideas was probably the most enriching aspect. Also really enjoyed being able to visit a rural hospital site and share that with students and see their, I think as a nurse educator, just seeing the students' growth and thinking, it was one of the most satisfying aspects of the project. When they come in not knowing a lot about rural healthcare, nursing, and challenges, and coming out with a very solid understanding of what those challenges are, and no matter where they're practicing, they'll have that knowledge base to kind of understand and empathize with the patient.
And I would echo all of the comments that Jessica has made about there's so many experiences. I think, again, similarly as an educator, seeing the growth, I think that with the Canadian students, it was too easy sometimes when it came to answering questions for them to sort of hang back and look to see if I would answer those questions. And so offline, I was prompting them a little bit and saying, okay, so if there's questions about funding, you guys need to know how healthcare is funded in Canada. So go to the source, take a look at who pays for those flights out of Nunavut, where and why is that covered by the federal government, and make sure that you understand that. And so prompting them to do that, so that they were the ones who then were jumping in and sharing and answering those questions. And then I have to say too, I was so envious of the immersive experience and wanted to be there myself, and love listening to the speakers, and in particular one physician who spoke to both cohorts and shared his experience. And it just, I still think about both experiences to this day, because really resonated to me how we define rural healthcare and why it is so important for both of our countries to ensure that we fight to keep access to healthcare in our rural communities.
What advice would you share with other faculty who want to develop a joint learning experience for students in 2 or more countries?
I would say, well, I know that I met Kim through the leadership at Global Rural Nursing Exchange Network, kind of helped us get to, connect, to get that first step to connect. So I would think reaching out on the Global Rural Nursing Exchange Network to find an international collaborator will be like one of the first steps to starting those conversations.
Mm-hmm. And then I think I would say too that, just the continued communication and collaboration and flexibility. So, back to the question about differences in academic terms, being able to say, okay, so our term is a little bit different, but let's see how we can make that work. Time change wasn't a significant issue for us because it was only about an hour difference, but it could be a significant difference. So then factoring in and thinking about a time change. And so how would that work? Could we, I mean, we have students that go out in the evening. So could we then have a session that took place in the evening if it's an expectation anyway? So I think that's key too, is that communication and flexibility and openness to doing things a bit different.
What type of training do you find most appropriate for this type of experience?
Like first, to prepare our nursing students or to prepare the project leaders?
Simona, you had asked that question. Would you mind clarifying that a little bit further in your chat? And while she's doing that, why don't we share another one? This is, so since you both had groups this past academic year, do you anticipate repeating the experience with another grant supported group next year?
I would love to. I'm currently having conversations and planning more on that, but it would be good.
Yes, absolutely. We would love to do that too. And I know that the Canadian students that participate have spoken to some of their peers. And so I think the word is out that this was something that took place. And so I think that there's interest in these types of opportunities for students for sure.
So a question that was asked was, what would be suggested policy changes? I know at one point in your presentation, you had addressed the need for that. So that was a question that had come through.
Mm-hmm. So I'm speaking from a Canadian perspective. Our policy changes, there's different changes that I would see from, even from a funding level. When it comes to rural healthcare access in Canada, we really have had probably about a good, in Ontario, the province I'm in, and probably echoed in other provinces and territories, a good 20 plus years of lack of attention to rural healthcare infrastructure. And with that has come a devaluing of rural healthcare providers. And so I think policy, I see, a number of levels of policy, policy around funding of healthcare for rural facilities that is not the same as what's happening from that urban centric lens, and then being plopped into a rural community and saying, okay, make this work because this is how we fund all hospitals, when that's not going to work for a rural hospital. And then similarly, when it comes to nursing staffing, there's just so many policies that come out around recruitment and retention right now, because we do have critical shortages. And it's very frustrating because they're, again, coming from that very single-minded lens and not thinking about how, some of those programs sound great, but they don't work if you have one RN that functions in your emergency department overnight, and that person's sick and they call in sick and you have to close a department. And so I think there needs to be a shift in policy development that really understands and values rural healthcare and rural healthcare providers and the work that they do.
So going back to the previous question, what type of training do you find most appropriate for this type of experience? It was asked specifically regarding nursing students.
For our cohort in the US, and I believe in Canada too, they were more advanced in the program. So our students, most of them were senior second semester, one was in their first semester, but they, I think, having had all of the prerequisite coursework up until their last semester, I think they could apply and put it all together and think about rural nursing as a specialty. What are your thoughts about that, Kim?
I would say same thing. So our students were also in their senior years of the program. And so by that point, they'd had some preparation in recognizing, funding structures and talking about how the system is funded, in looking at policy and how policy impacts on nursing practice. So they had some beginner understanding, which I think was really important, because when you start talking about funding, they need to understand where money's coming from and how that supports different aspects of healthcare. So I think it would be very difficult for an early year student to be able to jump in and do that, because they just, they haven't really started to have those conversations. And similarly, the community piece too. I know that was a question in the chat also, having had a community course where, for the children's visit, there was a windshield survey that was conducted, for example. So even knowing what that is, what is a windshield survey? Why would you do that? Are all important features for students to have in order to engage in this type of learning.
So now that you have finished your program for this specific grant period, what questions do you still have remaining? If any.
I think it's an ongoing question, is how to continue to develop the interest and engagement for nurses to think about going into rural and remote settings to practice. I think what I tend to see from the Canadian students is that there's a sense of, oh, I'd really like to do that, but I really should go work in a big hospital for a couple of years first and get my skills solid before I do that. And there's two minds of thinking around whether that's the best approach or not. And sometimes for a lot of the new nurses, or a lot of the students that I've been working with, at least in Canada, there's fear. It is a bit fearful to think about going to a place like Nunavut, for example, where you might be in a nursing station and there are no physicians on site. And so care is really provided by the nurses. And so I think that just that overwhelming sense of responsibility and accountability. So for me, the question is then, how do you support, because Nunavut has a 62% nursing shortage right now. That's how short they are. And so we need new nurses to go there. So how do you support new nurses to go to settings such as that and feel supported so that they can develop themselves as skilled and expert rural and remote nurses? So that's my big question. Jessica perhaps has a different question.
I was thinking the same along the lines of, I wonder what the long-term interest will be of our cohorts in pursuing rural nursing, and kind of how, I guess that would be one of my remaining questions, how this has impacted their thinking as they begin their career in nursing. And
Well, thank you. I believe that I've captured all the questions. I know that there was some conversation in the chat. I do think some of those questions are answered. If I did miss one of your questions, or if you have something else that you would like to share, please go ahead and post that for us. I know people are saying that they did get a lot out of the windshield survey. And there's a lot of accolades coming through for the work that you've done and what you've shared today. So thank you. It is, everyone's saying it is important to expose students to the rural experience. So while we give everybody a couple minutes to think of a few more questions, should you have any, I want to go ahead and just bring up one last slide, just so that way everyone has this information should you choose to connect further. I know both Kim and Jessica were sharing their connections in their presentation, so I hope that you caught that. And if you want to reach out to them, I know that they would enjoy connecting further. We also invite you to connect with both Kim and Jessica and the rest of our global community from the GRNEN website. Once you're on GRNEN, or you can go directly to community.grnen.org, as you can see up here. That's where you'll find our virtual forum, our virtual community. I know both Kim and Jessica talked a little bit about that and how they're group had the opportunity to collaborate online. There is an open forum where you are welcome and encouraged to ask questions, whether it's specific to this presentation or just anything in general regarding anything that you need to know or have questions or just want to just collaborate with our worldwide community. It's why it's there. It's at no cost to join. And you can also find both Kim and Jessica in there, and you can connect with them directly through the site. We are, as you know, recording this session. The goal will be to have this posted probably early Tuesday. I will be sharing that notification out to everybody. So once it is posted, and if you want to come back and listen to it again, share it with friends, colleagues, students, peers, please feel free to do so. The more exposure we can have to this opportunity, I think that the greater our learning opportunities are. As we said earlier, this is the first of 5 grant presentations that we are going to be sharing. The rest of the presentations will be coming, I believe it's the 2nd or the 3rd week of June. I'm not sure how the calendar falls, but if you visit grnen.org/events, all of our presentation schedules are up there, as well as signups. So you can go ahead and register to attend any of the future ones. As this one, they will also be recorded. I know everyone's schedule is tight. So if you aren't able to attend one that really piques your interest, we will be posting those recordings on our website. And I do know that there were a couple of questions regarding the grant program. Yes, the MHCH Foundation has been generous enough to extend the grant program into the 2022-2023 year. The application process is actually open right now. If you visit our website, you can access the details and the eligibility guidelines, as well as the online application. Our application will be open through August 1st of this year, with awards to be expected the following week. And the program will kick off September 1. So we encourage anyone who has loved what they heard today. If you have questions about it, you can reach out to anyone at GRNEN. Our email is info@grnen.org. The community is a really great place to connect with all of the grant participants this year, our leadership, the founders, anyone that can help you embark on this journey, because it is a really special opportunity. I'm getting a couple more questions. I just want to make sure. I think it's mostly people just, again, thanking you. And as I'd like to as well, thank you so much, Kim and Jessica, for taking the time to put this together today. It really was enjoyable to listen to everything that you did. I'm sure everybody got a lot out of it, and I look forward to hearing more from you down the road.
Yeah, and I would like to say the same. Thank you. I hope that the two of you are really proud of what you've accomplished over the semester with your students. So, and I really love, Jessica, the question that you posed about how we might learn how the collaboration impacted the students' perceptions of rule. So I think that's a great question to think about, and how we might try to understand how we track that in the future as we move forward with these grants. But I want to really commend both of you, and thank you so much for helping to make this first round of grants a really amazing experience for everyone. So, thank you.
Okay, well, it doesn't look like we have any additional questions. So we will close off our webinar today. Thank you again, everyone, for your time. We appreciate it. We know your schedules are precious. So it was great to have everyone here. Thank you again, Kim and Jessica and Corey, MHCH Foundation. And we look forward to seeing you all online soon. Take care, everyone.
Bye.
Have a good summer.
Thank you.
Well,